Hi, and welcome to Home Care This Week. Depression is a large and growing issue in the entire population in our country, but in the senior population it particularly is, and a lot of people don't think of that, don't think of seniors and depression in the same light, but it really needs to be, because it is a big and growing problem. And depression can have a whole bunch of different aspects to it, can have a wide range of issues, and so need to be addressed differently. A doctor that can go through and understand it, recognize it, diagnose it, and then figure out the appropriate options and the appropriate treatment is really critical. And it's something that families cannot ignore, particularly in their loved ones who are seniors. I had a chance to sit down and talk with Dr. Paula Bailey Walton of the Heritage Sierra Medical Group. She treats many patients, including seniors, with depression. One of the interesting aspects of it, as we went through our conversation, was the difference between men and women in terms of symptoms and how they exemplify and show what the situation is in terms of depression. And here's a little segment of what we talked about, so that you get a better understanding of that issue. We're here with Dr. Paula Bailey Walton at Heritage Sierra Medical Group, and we were talking a bit about depression, and that's the topic we're going through today. And I appreciate you taking some time and going through with us and so on. And the idea here is, and we're a senior-focused kind of thing here, and what happens is in particular with families, yeah, I guess if you have a senior who is concerned about depression and so on, but usually where it comes up is with the family. They're the ones concerned about the senior and depression, and maybe we could talk a little bit just in general about depression, and then about how it is similar and different in the senior population than just any other population.
Well, it is a growing problem in the senior population. We see it in over 16 million Americans, and it affects 18% of the population in the U.S. currently. 18%
of seniors, or 18% of all?
All.
Of all, okay.
And the people over the age of 65 are one of the fastest growing groups.
Wow, okay.
So
what kind of things, so it's a problem, so that's a general problem. So what kind of things that people look for, and what are you looking for when you see that this might be a problem here?
Well, it's twice as common in women as it is in men. And women have more physical complaints. They may complain of fatigue. They may have sadness, crying spells. They may have loss of interest in things they used to enjoy. They may complain of chest pain, palpitations, abdominal pain, back pain, the fibromyalgia type symptoms. Whereas men will present more with irritability, with anger, with withdrawal. They'll stop doing hobbies that they enjoy and become more socially isolated.
Okay, so the depression in terms of men and women is going to be the same, but the symptoms and what you're looking for could be a little bit different. The commonality here is in men is a little bit more anger and
irritability.
Okay.
More so than sadness. So men, you don't really see sadness as much as you'll see sadness in women. And in fact, a third of depression presents without sadness. And so when people think that that's got to be one of the hallmarks of depression, that's not true.
That's really important. So that anger and that grumpiness.
Right, that grumpy old man, the irritable, crotchety neighbor, is who we're thinking of when we think of men with depression.